I think that self-regulation and professionalism is almost a thing of the past. And it's happened because we've ceded it. I think that organized medicine, at times has focused too much on reimbursement and has not sort of done enough internally within the profession to actually, I think, do some of the kind of self-regulation that's necessary. And so it's given way to this external regulation. And I will just tell you, having worked, in Washington in policymaking kind of roles, there are specialty societies that truly care about patients, and then there are specialty societies that truly care about reimbursement. I'm not going to name them right now because I don't want to get shot. But ultimately, the reimbursement story is how the entire profession is viewed in the city of, in the capital, largely because our professional societies, rather than advancing a proactive narrative about healthcare reform and patient care and supporting patient safety, are spending a lot of time focusing on the reimbursement. I think it's not an either or. I think it's a both and I think the challenge is that the narratives have gotten a little bit drowned out. I think that most of our, I mentioned that my sort of early days at HMS were spent trying to implement a healthcare policy curriculum at the school. I will tell you the funny story of how HMS eventually got a healthcare policy curriculum. There was a faculty member who needed, sort of to check the I teach medical students box, and they got a healthcare policy course. It didn't matter that the students thought that they needed it. It didn't matter that society really sort of, I think, fundamentally needs physicians who are educated about management and policy. And so we live in this deep ignorance about these things. And so you look across the profession, and whether you're a recent graduate or you're 50 years outside of medical school, we're all operating, I think, with a low baseline of knowledge about policy and management. And ultimately, I think we're unable to influence the system because we're not fully sure how it actually works. And then I think despite being under siege, we as a profession have not organized ourselves and frankly advanced a sort of a counter narrative and really developed the causal stories that put us in sort of that positive nightly, I think, perspective as opposed to the knavish one that has evolved. And I think what's much to our detriment, we've arrived at a place where we are not trusted to do what's right for patients unless there's a carrot or a stick somehow attached to it. And I think that there's an opportunity for us to, as a profession, to work to actually advance some new narratives. And I think we're all uncomfortable with this pawn and knaves approach. I think there's the Cochrane review that says that pay for performance programs actually have a marginal impact on patient care. I think Elise can say more about that than I can. I think there's troubling evidence that hospitals and physicians are using sort of upcoding when they are given more incentives, and there's lots of evidence of fraud and abuse. You read these stories every day, and ultimately they're the exception, right? These stories really exist in the margin. I think most physicians are trying to do right. Most physicians want to take good care of their patients. We're all, I think, motivated by knightly intentions. But the sort of knavish element within our profession is actually driving more of the kind of public narrative and perspective on who we are and what we do than anything else. And so I really think that this perspective is producing terrible results for society. I think it's really focused, it's created this excessive focus on documentation as opposed to real patient care. I think there's an ignorance of the fact that clinical outcomes are actually, produced by teams and not by individual physicians. I think, the sort of, I think we need to kind of retell that story. And I think, the fundamental message I want to leave you with is this notion that the intrinsic motivation that exists within all of us needs to be preserved, grown, and honored. I think it is the most precious asset we have in our healthcare system is the intrinsic motivation of people. And I've spent the last 2.5 years, sort of both working at the VA hospital, but also working within a large corporation. And what I'll tell you is that this is what makes us as a profession different from other people. We will do the right thing even if we're not paid for it. And that is something that actually gets forgotten, it gets lost, and we don't call each other out when that sort of more base instinct actually comes out. And I don't know if any of you have read Sandeep Johur's book, Doctored, or if you've seen it, or if you've seen it reviewed, but it tells a very grim story of some of the more base element in our society. It really recounts sort of what kind of private practice medicine in Long Island looks like from a private practice cardiologist perspective. And it's not a good story. And I think we have to start to change the story, and we have to start telling new stories. And I use the word story very deliberately here because it is about telling the story. It's about creating the public narrative and perception around the profession, how we communicate over the dinner table, how we communicate in public forums, how we present ourselves. I think we've become too disgruntled for our own good. And so I think that there's an opportunity for us to really reshape the story. And I want to leave you with Legrand's caveat, which I think is the most important part of his paper. And I'll just read it verbatim because I think it's so powerful. It says, "Disaster may follow if persons largely of a knavish quality are treated as knights. But the same may be true for policies fashioned on a belief that people are knaves if the consequence is to suppress their natural altruistic impulses and hence destroy part of their motivation to provide a quality public service." And I think that's really what's happening here, is that we're losing these sort of more intrinsic qualities that we all have in favor of I think a piecemeal pay-for-performance kind of view of things. And there's an emerging science of human motivation. There's Pink's work on this as well as Trisellini. And the sort of basic issue is that intrinsic motivation is always way more powerful a driver for folks than extrinsic motivation. There are some behaviors you cannot pay people for. They just come from within. And I think if we actually look at those behaviors and we honor those and we model those and we support those and highlight those, I think we can get a lot farther than if we focus excessively on payment as a means for achieving our social ends. And so I think part of what we put together is maybe a possible set of solutions: pay physicians a rewarding yet reasonable salary rather than actually paying them for piecework, and provide a direct ability to influence patient outcomes and a sense of continuous accomplishment and recognition. We've lost this notion of accomplishment and recognition. I think we've been self-flagellating ourselves as opposed to, I think, sort of holding up the profession for who we are and what we can do. And I think we should be rejecting incentive contracting that minimizes the complexity of the work. When you start to kind of break it into pieces, I think you dishonor the broader complexity. I like to think of clinical care as mass customization rather than sort of line work. And I think we've gotten too much into this line work view of things as opposed to thinking about it as a custom body shop as far as analogies goes. And if we are going to measure quality, and I want to say that my view is a little bit complicated here because I do believe in quality measurement, I do believe in public reporting, but we need to focus on what actually matters and what matters to patients and what matters to clinicians, as opposed to certain things that are just meant to serve masters that are, I think, far removed from the actual delivery of care. And we have to default into making things making it easy to do the right things for patient. And again, I just want to repeat, just find ways to honor and reward the intrinsic motivation that I think all brought us to the profession.